Last year, I had a patient, a 68-year-old retired school teacher, who came to me with numbness in her left hand that wouldn't go away. She was active. She walked every morning. She ate well, or at least she thought she did. Her blood pressure was managed. Her cholesterol was fine. On paper, she was the picture of a healthy senior. But when I asked her about her supplements, she pulled out a plastic bag with 7 bottles in it. 7. She was taking vitamin D, calcium, a B complex, fish oil, magnesium, vitamin E, and a multivitamin on top of all of it. Every single morning, all at once, washed down with her coffee. She told me her daughter had set it all up for her, that she'd read articles online, that she figured if a little was good, more had to be better. When I explained to her what 3 of those supplements were doing inside her body when taken together, the look on her face is something I will never forget. She had no idea. Nobody had told her. Not her doctor, not the pharmacist, not the articles her daughter had read. And that numbness in her left hand, it was a warning sign, a transient ischemic attack, a mini stroke, caused in part by a combination of supplements that were quietly destabilizing her cardiovascular system every single morning for the past 2 years. I'm Dr. Denise Warren. I've spent over 25 years in clinical medicine, and I am tired of watching good people harm themselves with supplements they were told were safe. Today, I'm going to show you 3 specific vitamin combinations that dramatically increase your stroke risk when taken together. These are not obscure supplements. These are the ones sitting in your medicine cabinet right now. Stay with me because this could be the most important thing you hear this month. Before I tell you which vitamins, I need you to understand something about how strokes actually happen, because without this foundation, the rest won't make sense and you won't take it as seriously as you need to. Your brain is the most blood-hungry organ in your entire body. It accounts for roughly 2% of your body weight, but consumes 20% of your blood supply. Every minute of every day, blood is flowing through an incredibly dense network of vessels inside your skull, delivering oxygen and glucose to billions of neurons. Now here is the critical part. That blood has to be in perfect balance. Not too thick, not too thin, not clotting too easily, not flowing too freely. Your body maintains that balance through an extraordinarily precise system of clotting factors, platelet activity, vessel wall integrity, and blood pressure regulation. After 60, that system is already under strain. Vessels are stiffer. Plaque may be forming in places you can't feel. Blood pressure regulation is less precise. The margin between safe and dangerous is narrower than it has ever been. When you add supplements to that equation, you are not adding safety, you are adding variables. And when certain variables combine in ways your body was never designed to handle, the system tips. A clot forms where it shouldn't. A vessel ruptures under pressure it can't absorb. Blood flow to a section of your brain stops, and in minutes, the damage is done. That is a stroke. And what I'm about to show you is how 3 common vitamins, taken together, push your body toward exactly that outcome. The first combination I need to warn you about is one that millions of seniors are taking right now as you listen to this. High-dose vitamin E combined with fish oil or any omega-3 supplement. Let me explain why this combination is so dangerous. Vitamin E is a fat-soluble antioxidant. On its own, in moderate doses from food sources like nuts, seeds, and olive oil, it's perfectly fine. It protects cell membranes from oxidative damage. Your body uses it well. The problem starts when people take supplemental vitamin E, typically 400 IU or higher, because they read somewhere that it protects the heart or prevents cancer or slows aging. At those doses, vitamin E does something that most people have absolutely no idea about. It acts as a blood thinner, a potent one. Vitamin E inhibits platelet aggregation. It interferes with the clotting cascade. It makes your blood less likely to form clots. Now, on its own, in a young person, that might be manageable. but you are not taking it on its own. You are taking it alongside fish oil. Fish oil, omega-3 fatty acids, EPA and DHA, also thin your blood. That is actually one of the primary mechanisms by which fish oil provides cardiovascular benefit. It reduces platelet stickiness. It makes blood flow more freely. So now you have two powerful blood-thinning agents working simultaneously. Vitamin E thinning from one direction, fish oil thinning from another, and your blood, which after 60 is already being managed by a system with less margin for error, becomes dangerously thin. What happens when blood is too thin? You bleed more easily. Internally, in places you can't see or feel. And the most catastrophic place that can happen is inside your brain. Hemorrhagic stroke. A blood vessel in the brain that was already weakened by age, by high blood pressure, by years of wear, finally gives way because the blood flowing through it has lost its ability to clot quickly enough to seal a small breach. I have seen this happen. It is devastating. And in nearly every case, the patient had no idea their supplement combination was a contributing factor. If you are taking both vitamin E supplements and fish oil, talk to your doctor. You may not need both. And if you are also taking a blood-thinning medication like warfarin or aspirin on top of that, the risk multiplies dramatically. 3 blood thinners at once. I see it more often than you would believe, and nobody connected the dots until something went wrong. The second combination is one that genuinely alarms me because it involves two of the most commonly recommended supplements for seniors: calcium and vitamin D in high doses taken together without vitamin K2. Now, I need to be careful here because I am not telling you that calcium and vitamin D are bad. They're not. Your bones need calcium. Your body needs vitamin D to absorb that calcium. That part is true. The problem is, what happens when you take high doses of both without the third piece that directs where that calcium actually goes? Let me walk you through exactly what happens inside your body. You take a high-dose calcium supplement, let's say 1,000 to 1,500 milligrams. You take it with vitamin D3, maybe 2,000 to 5,000 IU. The vitamin D dramatically increases your intestinal absorption of calcium. Suddenly, there is a flood of calcium in your bloodstream, far more than your bones can absorb in a single sitting. Now your body has a problem. All this calcium has to go somewhere. Without vitamin K2, your body has no efficient mechanism to direct that calcium specifically into bone tissue, so it deposits wherever it can. And one of the primary places it ends up is in the walls of your arteries. This process is called vascular calcification, and it is not theoretical. It is measurable. It shows up on CT scans. And it is one of the strongest independent predictors of stroke and cardiovascular death in adults over 60. Calcified arteries are rigid arteries. They cannot expand and contract with each heartbeat the way healthy vessels do. They cannot absorb pressure surges, and the rough, calcified interior surface creates turbulent blood flow that dramatically increases the likelihood of clot formation. A clot that forms on a calcified arterial wall inside or near the brain has a direct path to causing an ischemic stroke. A study in the British Medical Journal found that calcium supplementation without K2 was associated with a 27% increased risk of heart attack. Other studies have linked it to increased stroke risk as well. And here is the part that makes me angry. Vitamin K2 solves this problem. It activates two proteins, osteocalcin and matrix GLA protein, that work together to pull calcium out of your blood and arterial walls and deposit it into your bones where it belongs. It is the missing piece that makes calcium supplementation safe, and almost nobody is taking it. I ask every patient over 60 who takes calcium the same question. Are you also taking K2? The answer is almost always no. They have never heard of it. Their doctor never mentioned it. The calcium bottle doesn't say anything about it. If you are taking calcium and vitamin D together, please add vitamin K2, specifically the MK7 form, 100 to 200 micrograms daily. This is not optional. This is the difference between strengthening your bones and calcifying your arteries. And while you're at it, consider getting more of your calcium from food. Dairy, sardines, leafy greens, almonds. Food-based calcium is absorbed slowly, in small amounts, alongside the cofactors your body needs to use it properly. Supplemental calcium in large bolus doses is the problem. Your body was never designed to process that much calcium all at once. This third combination is the one that caught my patient, the retired school teacher, completely off guard. And it may be the most widespread, dangerous combination of all because both supplements are marketed as essential for heart health. High-dose B vitamins, specifically B6 and B12 and folic acid, combined with high-dose vitamin E. Let me explain what happens when you load your system with all of these simultaneously. B vitamins, particularly B6, B12, and folic acid, are involved in a critical biochemical process called methylation. One of the key things methylation does is break down an amino acid called homocysteine. High homocysteine levels are associated with increased cardiovascular risk. That is well established. So the logic seems simple. Take B vitamins, lower homocysteine, protect your heart. But the reality is far more complicated than the supplement labels suggest. When you take high-dose B vitamins, particularly folic acid in its synthetic form, you can actually mask a B12 deficiency rather than correct it. Synthetic folic acid at doses above 400 micrograms can normalize blood tests, while B12 deficiency continues to cause neurological damage in the background. Undetected B12 deficiency causes direct damage to the myelin sheath that protects your nerves and your brain's blood vessels. It also elevates homocysteine through a different pathway that folic acid alone cannot address. So you have a patient who thinks their B vitamins are protecting them, whose blood work looks normal, but whose nervous system and vascular system are quietly deteriorating. Now layer vitamin E on top of that. Remember, vitamin E is a blood thinner. It inhibits clotting. In a body where B12 deficiency is silently weakening blood vessel walls, while vitamin E is simultaneously making blood less able to clot, you have created the perfect conditions for a hemorrhagic event. Weakened vessels plus thin blood equals rupture risk. A major clinical trial called the HOPE-2 study followed patients taking vitamin E supplements long-term and found a statistically significant increase in heart failure. Other studies have found that high-dose vitamin E supplementation provided no cardiovascular benefit and in some cases increased overall mortality. When combined with the hidden risks of high-dose synthetic B vitamins masking deficiencies, the combination becomes genuinely dangerous. What should you do? First, if you are taking a B complex or folic acid supplement, ask your doctor to check your actual B12 levels with a methylmalonic acid test, not just a standard blood panel. Standard B12 blood tests can appear normal even when you are functionally deficient. Second, get your B vitamins from food whenever possible. Eggs, meat, fish, dairy, leafy greens. Your body knows how to process B vitamins from food in a way it simply cannot replicate with synthetic supplements. Third, stop taking high-dose vitamin E supplements unless your doctor has specifically prescribed them for a documented medical reason. The evidence for supplemental vitamin E benefiting cardiovascular health has collapsed over the past decade. The risks are real. The benefits are not. I want to pause here and put all of this in perspective because I know what some of you are thinking right now. You're thinking that you take some of these combinations. You're thinking that you've been taking them for years, and you're wondering whether the damage is already done. Let me be direct with you. I am not here to scare you. I am here to inform you. The human body is remarkably resilient. Stopping a harmful combination today does not erase every day you took it, but it dramatically reduces your risk going forward. Blood vessel walls can recover when the insult is removed. Clotting balance can normalize when the thinning agents are reduced. Calcium deposits can stabilize when K2 is introduced. Your body wants to heal. You just have to stop giving it reasons not to. Now let me tell you something that most doctors don't have time to explain in a 15-minute appointment. The supplement industry is not regulated the way pharmaceutical drugs are. In the United States, supplements do not need to be proven safe or effective before they hit the shelves. The FDA does not approve them. The manufacturer does not need to demonstrate that combining their product with other common supplements is safe. There is no requirement to list interaction warnings the way prescription medications do. That means the responsibility falls entirely on you, and on your doctor if they know to ask. Most don't. Not because they're bad doctors, but because supplement interactions are not covered extensively in medical training. The system has a blind spot, and millions of seniors are sitting directly in it, taking combinations of supplements that no one has evaluated for safety, in doses that no one has verified are appropriate, for durations that no one is monitoring. You are not one of those people anymore, because now you know. Let me bring it all together one final time. Combination 1, high-dose vitamin E plus fish oil or omega-3 supplements. Both are blood thinners. Together, they make your blood dangerously thin, increasing hemorrhagic stroke risk. If you take both, talk to your doctor about whether you need both. If you are also on a blood thinning medication, this conversation is urgent. Combination 2, high-dose calcium plus vitamin D without vitamin K2. The calcium floods your bloodstream. Without K2, it deposits in your artery walls instead of your bones. Vascular calcification increases stroke and heart attack risk dramatically. Add vitamin K2 MK7, 100 to 200 micrograms daily. Get calcium from food when possible. Keep supplemental doses below 500 milligrams at a time. Combination 3, high-dose B vitamins, especially synthetic folic acid, combined with vitamin E. Folic acid can mask B12 deficiency while neurological and vascular damage continues. Vitamin E thins blood on top of weakened vessels. Get B vitamins from food. Get your B12 properly tested. Stop supplemental vitamin E unless your doctor specifically prescribes it. 3 combinations. 3 conversations you need to have with your doctor. And 3 changes that could dramatically reduce your stroke risk starting this week. I want to be honest with you for a moment, not as a content creator, as a clinician who has spent a quarter century watching preventable damage happen to people who were trying to do the right thing. That is the cruelest part of this. These are not people who were careless with their health. These are people who cared deeply. They went to the store. They bought the supplements. They took them every morning because they believed they were adding years to their lives. And in some cases, they were quietly taking years away. The 68-year-old school teacher I told you about at the beginning, after we adjusted her supplements, after we added K2, after we removed the high-dose vitamin E and reorganized her entire protocol with her cardiologist, her symptoms improved. Her clotting markers normalized. Her follow-up scans showed no new vascular events. She calls me every few months now. She always says the same thing. Why isn't this on the bottle? I don't have a good answer for that, but I have this video, and you have this information, and that is a start. Which of these 3 combinations are you taking right now? Tell me in the comments. I read every single one. And please, if someone you love is over 60 and takes a handful of supplements every morning without knowing how they interact, send them this video today, not tomorrow, today. That conversation could prevent something that no supplement in the world can undo. If you haven't subscribed yet, please do. Every week I bring you honest, evidence-based information that I wish every one of my patients had heard years before they ended up in my office. Take care of yourself. Your body has carried you through decades of life. It deserves to know what you're putting into it. One last thing. Everything I've shared today is general health information based on current medical research and my clinical experience. It is not a substitute for your personal medical care. Do not stop any supplement or medication without talking to your doctor first. Bring this information to your next appointment. Write down the 3 combinations. Ask the questions. Your doctor is your partner in this, and these conversations work best when you walk in informed. That is not a disclaimer. That is genuine advice from someone who wants you watching this channel for a very long time. Take care.